Hi there, my name is Lisa Foster and I am the Chief Executive for Rare Disorders New Zealand. We have about 115 different rare disorder groups or rare disease groups within our collective, and we advocate and push for equity with our government. There are about 5 million people live in New Zealand, and we would expect about 300,000 people with a rare disease to be living here. It's quite a complicated picture, and I'll do my best to explain it in a simple and concise manner. So basically, we have been petitioning our government to put forward a national framework for rare disease in this country. And within that petition, we have gone to Parliament and are talking to our Health Select Committee. Unfortunately, there's a lot of complication. Obviously, COVID is a serious complication, and our country's been very responsive and remarkable in the way that it has responded to react well to our COVID pandemic. Unfortunately, that same response has not been the case when we are talking about equity for rare disease. So we have not been able to move forward with a national framework. We do not have recognition in this country of people with a rare disease as a specific population or vulnerable group. We do not have a definition of rare disease in this country. We have to borrow it from Europe. And we do not have a medicine policy that offers a fair and equitable assessment pathway for people with a rare disease in this country. On the positive note, we do have a wonderful health system that does offer support for people in general. And if you are in need in this country, you will get that support through our public health system in general. We also have a system called ACC, which is related to accidents. So if you have an accident, then you are adequately covered. You cannot be sued in this country. And under ACC, anyone who has an accident will receive healthcare free of charge. So there's some fantastic things that I can talk about regarding the country. But when it comes to rare disease, I cannot explain the positives because they're not there yet. So our request is still in place to our government to recognise, to act, and to include people with a rare disease so that they're not left behind. The stories that we share with government officials are from our collective and are very powerful patient stories, personal stories of difficulty and challenge and barriers coming from a system that has not thought about their needs adequately. We are hopeful that as this voice increases through our organisation as the peak body, then we are hopeful that things can change in the future. And the sooner it happens, the better, of course. So with that in mind, we continue our advocacy. We continue to talk to government officials across different ministries. We look forward to increasing our international connections and engagement, and to realize that we are a global community after all, and this is a global issue. So with that, I will bid you farewell and hope that the conference is a fantastic one and a great opportunity to connect. And remember that we are all part of the same unified voice. Thanks very much.